Good morning, everyone. My name is Doris Rodriguez, and we'll get started in just a few minutes while we give people a moment to get situated. So if you need to get anything, please do so now. We'll start in a couple of minutes. I also want to sure to announce that this presentation is available with automatic closed captioning. Additionally, we are providing simultaneous interpretation in Spanish this morning, for which I will now provide instructions for our Spanish Zoom attendees to join. Hoy siempre brindamos servicios de interpretación simultánea para nuestros eventos, igual en persona o en Zoom. Favor de hacer clic en el globo al fondo de su pantalla donde dice interpretación. Luego haga clic en el idioma que dice escuchar. En este caso, español. Si quiere escuchar solo al intérprete, puede también hacer clic en Mute Original Audio, que silenciará el audio original. Muchísimas gracias y de nuevo, bienvenido a Sinergia. Estamos agradecidos en tenerlos aquí. Before we begin, I want to let you know that we'll be broadcasting live via Facebook. So we want to give a warm welcome to those joining us there. A few housekeeping notes. Everyone who registered via Zoom will receive a copy of the presentation slide via follow-up email within the next few days. A survey will be shared in the chat at the end of the presentation. We will have time at the end for a Q&A. However, we encourage questions at any time. Please remember this is a public forum and we're being broadcasted live on Facebook. I will do that now. Just give me 1 second. Awesome. As I said, my name is Doris Rodriguez, and I'm the Autism Initiative Coordinator here at Sinergia's Metropolitan Parent Center. A few words about Sinergia's Autism Initiative. The Autism Initiative project is funded by a grant from New York City's Council under its Autism Initiative. This project supplements the work of Sinergia's Metropolitan Parent Center by bringing an increased awareness to New York City residents, particularly to the communities with large Spanish-speaking populations, about the growing number of children diagnosed with autism spectrum disorder. A strong outreach components target families of children with suspected or known diagnosis of autism spectrum disorder, and for those who are receiving appropriate educational, health, and other related services. The initiative will link them to other services and supports that meet the individual needs of children and their families. So I want to thank you all for joining us. We are glad that you chose to be here with us today. Before we get into it, I would like to introduce our presenter today. I want to welcome Dr. Chen Bosi, PhD Postdoctoral Fellow at Hassenfeld Children's Hospital at NYU Langone Department of Child and Adolescent Psychiatry Child Study Center. So glad you can join us today. We have so many questions, so I'll let you get to it. And for those joining us via Facebook Live, if you have any questions, please place them in the comment section. Now I'll hand it over to you, Dr. Chen.
It is my pleasure to be here, and I am going to start sharing my screen to present my slides. Just give me a moment. Great. Okay, so so thank you for the introduction. My name is Bosi Chen. I am a postdoctoral fellow at NYU Langone Health Child Study Center. And today I'm going to present on the topic of understanding and supporting autistic children and adolescents with co-occurring anxiety and depression. And this workshop is brought to you by the New York State Regional Center for Autism Spectrum Disorders at the Child Study Center at Hassenfeld Children's Hospital at NYU Langone Health. And of note that the content of this presentation is informational, but they're not clinical advice. We're really hoping that the information we share today can be helpful for parents, teachers, or other providers to gain better understandings of these co-occurring mental health difficulties in the autistic children and adolescents that we support, and maybe help them to seek the appropriate services. Just a quick outline of today's presentation. We're going to first discuss what are the co-occurring conditions that we often see in children with ASD. And then we're going to narrow in and talk specifically about the presentation of anxiety and depression, because that is the focus of this presentation. Then we're going to talk about specific considerations for implementing cognitive behavioral therapy interventions with individuals with ASD. And then we're going to give some, examples of those adaptations, as well as specific treatment protocols that have been developed for supporting the needs. As mentioned earlier, that we will provide a handout of today's presentation after, so that will summarize kind of some of the important information that we go over. And we should have some time at the end of the presentation to answer some questions. And thank you to those who have already submitted some questions at the beginning. So let's talk really briefly about the core symptoms of ASD. So the core symptoms of autism spectrum disorder includes two domains. One is deficits in social communication, and the other one is in restricted and repetitive behaviors. However, most individuals with ASD are not coming to therapy or treatment due to pure autism issues, quote. They're presenting to us oftentimes because of their associated features and conditions. And oftentimes these associated features or condition can co-occur. So for example, children with delays in language and social developments are at risk for using challenging behaviors as a way to communicate and that get their points across. Um, and some of these co-occurring conditions are kind of highlighted here. They can look like, things like language delays or intellectual disability, comorbid medical conditions, or they can also present with self-injury or challenging behaviors, and also other psychiatric conditions such as depression and anxiety, ADHD, and others. Um, with the increased stressors that come along with life, we also often see fluctuations in these associated features, such as emotional or mood difficulties and challenging behavior across the lifespan. But during today's presentation, we're going to focus on anxiety and depression. So one thing that often we need to emphasize is that co-occurrent conditions are very common. So especially co-occurring mental health conditions. And their rates is much higher in individuals with autism compared to the general population. So about 28% of individuals with ASD have a co-occurring ADHD diagnosis, 20% with co-occurring anxiety disorders, 11% with co-occurring depressive disorders, 9% with OCD and related disorders, and then 12% with co-occurring disruptive impulse control and conduct disorders. And in terms of identifying these co-occurring concerns, there are many different providers or ways that can help with the identification and appropriate diagnoses. So mental health providers are often the ones that provide these services. They will include psychologists like myself, social workers, psychiatrists, and sometimes primary care providers can help with identifying these co-occurring concerns. They oftentimes will administer standardized and non-standardized interviews and questionnaires to gather information about the child's behaviors, mood, and other concerns. And these interviews and questionnaires are oftentimes given to parents because they're the one who interact with the child on a day-to-day basis and is a really important source of information. And depending on the child's age and developmental level, sometimes the child will also be interviewed or complete questionnaires to report on their own um, experience or feelings to help make these diagnoses. And sometimes the teachers may be asked to fill out information or be interviewed to gather information about the child's behaviors and presentation at school, because that is a big part of their life, and they spend a lot of time in that setting as well. Um, Another ways to identify these concerns is through neuropsychological testing. Even though it's not really required for most like mental health diagnosis, but sometimes neuropsychological testing can be helpful, especially to help clarify the strengths and weaknesses of an individual child's like cognitive profiles or adaptive functioning and to help kind of uh, provide information about the potential differences in their learning, problem solving, or executive functioning skills. Um, for people who, are interested, neuropsychological testing are oftentimes more like standardized testing that might test the child's cognitive abilities, includes testing of memory, attention, and other executive skills, as well as questionnaires that we discussed earlier. All right. So now let's just jump into anxiety. So what are some of the symptom presentation of anxiety? They can look many different ways in individuals, especially in children. But anxiety itself, it's not inherently a bad thing, right? So it can actually be a helpful and healthy reactions during times that is actually dangerous to us. So, for example, if we are, in the wild and we have a lion charging at us, having anxiety is actually a natural or healthy reaction because we know, or it's a signal to us that we are in danger and we need to take actions, right? But at other times, that anxiety can actually be interfering when they're not to the level or signaling dangers in situations that are not actually inherently dangerous or warrant that response. So for example, if we are getting this anxiety reactions every time that we interact with other individuals or in social situations, that it can be really interfering of our daily functioning, going about our lives. So what are some of the symptom presentations or expression of anxiety? So they can present itself as a physiological symptoms or body reactions, including things like increased heart rate, breathing, sweating, or being shaky. Just like the figures that we have on the right, it can present itself in basically all parts of our body. It can also involve thoughts, right? So when we think about anxiety, we often think about worries, right? Having a lot of worries and concerns about what is going to happen. And when the anxiety is severe, it oftentimes leads to predicting the worst case scenario or misinterpreting information or situations. And anxiety can also result in specific behaviors that is interfering, such as avoidance, reassurance seeking, or repeated questioning in order to kind of soothe their own anxiety. We will get into more details about these symptoms later, but we just wanted to kind of show that they can look very different ways in different individuals. So now let's talk about ASD and co-occurring anxiety. So, like we mentioned earlier, anxiety-related concerns are among the most common presenting issue for individuals with autism. And the prevalence rate is estimated to be around 20%. So when we think about anxiety, we also need to take developmental factor into concern, right? So anxiety there are different types of anxiety disorders. For example, like separation anxiety, specific phobia, generalized anxiety disorder, panic disorder, agoraphobia, social anxiety, and selective mutism. What we know is that there are certain types of anxiety that are more common in certain ages. So, for example, separation anxiety and specific phobias are more common at younger age. Um, while during adolescence, there are overall heightened risk for anxiety, that they're more likely to present with anxiety when they're, an adolescent age. We think it's because there's this growing sense of self-awareness, and also there are in an environment there are increasingly kind of complex in terms of the social demands. Um, and then sometimes for children when they are in teenage years, they also have this stronger push and even desire to make friends. And for kids who have autism, that they have, this inherent difficulties with social skills that can contribute to these anxieties related to social interactions. And thinking about adulthood, adults also begin to experience more stress as they get older, related to establishing independence, right? Going to college or moving away from home, finding a job, or navigating like social relationship, like romantic relationship or workplace relationship. Um, and oftentimes they have less opportunities for social engagement when they're no longer in the school system or they're no longer in like a smaller environment with more similarly aged peers. So just thinking about the different developmental stages that our individuals are in that can kind of lead to anxiety or that can have increased risk of anxiety due to different situations. Um, so I just want to talk a little bit about social camouflaging. This is a concept that's often discussed in the context of neurodiversity, particularly in ASD. It kind of refers to the strategies and behaviors that individuals use to blend in or to mask their differences in social situations. And these strategies can look like, imitating others' facial expressions or gestures or speech patterns of their peers. So while social camouflaging can actually be helpful for individuals to navigate their social environment, it can also be exhausting and stressful because they have to constantly monitor and adjust their behavior in order to conform to the social norms that they're in. Um, so that's another things to keep in mind when we're thinking about ASD and anxiety. Um, let's think a little bit about what are the common source of anxiety in our autistic individuals. So transition is a big one, right? So we know that autistic individuals oftentimes have more difficulty transitioning from one activity to another, such as or to another environment. For example, transitioning from home to school, transitioning to summer, or having a substitute teacher can be particularly stressful for these individuals. And predictability and routine are often very important for children with ASD. So any sudden change or unexpected change in their daily schedule or environment can cause distress and anxiety. And unstructured time can also be anxiety provoking because they may not know what to expect or how to engage in those times. And autistic individuals have challenges navigating social situation, in particular when the social demands are high or the social rules are more ambiguous. And these in situation can lead to social anxiety. And many children with autism also have heightened sensitivity to sensory stimuli, such as loud noises, bright lights, certain textures, or smells. And these sensory input can be overwhelming and lead to significant anxiety. Or lastly, thinking about situations that require them to be in the center of attention, or when they are, when they have to perform, such as taking a test, public speaking, or sports event, can also cause anxiety due to fear of failing or making mistakes. So I just want to give an example, right? So think about a 3-year-old boy, right, who has significant anxiety about hearing happy birthday song, especially when they're saying to him. But let's think about what are the kind of the source of anxiety in this situation, right? So it could be an aversive reaction to the song being too loud, right? Thinking about the sensory sensitivity and also the sudden and surprising nature of the song, right? So it's all of a sudden somebody is saying happy birthday to him, that can trigger some anxiety. And there are also a large group of people saying maybe the light is being dimmed and then he's being the focus of attention. So a lot of those factors can contribute to why this little boy is really fearful of happy birthday songs. It's important to recognize that, anxiety symptoms in children with ASD may not always align with the typical presentation of anxiety we might expect. So here are some of the ways that anxiety can express itself. For example, the individuals may avoid new or familiar situation stemming from anxiety of not knowing what to expect or how to act. They might withdraw from social situations to avoid the stress and discomfort that these interactions can cause. They may resist changes, prefer rules, and insist on sameness. Um, these can act as way to manage their anxiety and maintain a sense of control and predictability. I think we all can relate to the fact that, uncertainties can lead to anxiety in our lives. Just imagine this being even more challenging for our individuals with autism. And when feeling anxious, children with ASD might engage more frequently in repetitive behaviors or being more intensely focused on their special interests. Again, these behaviors can kind of serve as coping mechanisms for them to self soothe and manage their anxiety. So oftentimes that people will come to our clinic with concerns about oppositional behaviors. They might look like, saying that they won't cooperate, they will always want things their way, they don't seem to put in the efforts, being lazy, or they're spoiled, right? These interpretations can sometimes be misleading because sometimes behaviors that seem difficult or defiant at first can actually be rooted in anxiety. So if we kind of reframe these behaviors from the perspective of anxiety and autism, we can instead see our kids that they may be struggling with anxiety and trying to cope in the best way that they know how. And it will also help us to understand and respond with more empathy and support. I'm not saying that all challenging behaviors are stemming from anxiety, But there are sometimes more often seen in autistic kids is that, because there are difficulties with communicating their feelings or their anxiety with words because of their language difficulties, that they may result in more challenging behaviors because of anxiety. Now, let's talk briefly about depression. So here are just some common symptoms of depression in children with autism. So things like persistent depressed mood or irritable moods. You may see more crying spells or tearfulness. Sometimes it may look like increased aggression, changes in their sleep and eating behaviors. They may lose interest in activities that they used to give them joy. They may look like they don't care or they're less interested in what's happening around them. And they may be less socially engaged when they're depressed. And they might be more engage with their preoccupations or like their special interests. They might be more kind of rigid when they're depressed. They may also we might also see an increase in OCD behaviors if that's something that they engaged in. um, and the big things to look out for is if there's any kind of change in their baseline functioning, right? Things that they used to do or they used able to do, they're no longer able to do anymore, or activity they used to engage in, they're less interested in engaging in those activities anymore. So children in general have a harder time verbally to express their subjective experience of depression. And children with autism in particular, given their social communication difficulties, can have an even harder time verbalizing and sometimes just being aware of their depressive symptoms. So it can make it really hard for parents to see the signs, and even for professionals doing these assessments and diagnosis. It's challenging to do these assessments as well. I know there's a lot of information here, but it's mostly kind of a symptom clusters that we often see in depression, right? So on the left, there are these traditional signs and symptoms of depressions. These are the characteristics that you will look for in depression presentation. And when you see the stars here, these are the symptoms that are more commonly seen in children compared to adults. And on the right here, these are some additional signs and symptoms they may be present in autistic children who are also experiencing depression. So just to highlight a few, right? So we might see more behavior like aggression um, and hyperactivity in autistic kids when they're depressed. We may see a decreased adaptive functioning or self-care activity, things like, brushing their teeth, getting dressed, those daily living skills, or doing chores, things like that. um, you might see more fluctuations in their autistic symptoms. So that may look like increased stereotyped behaviors or repetitive behavior, or decreased interest or increased interest in those restricted interest that might not be seen in kids without autism. So now we've covered what depression and anxiety can look like in autistic individuals. We're going to now talk about treatments for mood and anxiety disorders in ASD. I want to give a quick overview of what we call CBT, cognitive behavioral therapy. Um, it is one of the most effective approaches for treating pediatric anxiety and other mood disorders. So CBT focuses on the connection between thoughts, feelings, and behaviors. So this is a model that we typically introduce to patients and families about what CBT is. So you would think about, any instance of anxiety in the context of an event, like the situation. So this is an example that can help illustrate that, right? So basically, it's thinking about what triggered the anxiety, what triggered the problem. Um, the situation here is that, let's say I was, criticized by my supervisor at work, and that can trigger certain thoughts, negative thoughts in my head, right? The thoughts may be I'm not good enough, I'm not competent, my supervisor hates me, right? Those negative thoughts. And when we have those thoughts, that can also lead to physical reactions, right? I might be feeling really tired, or I may be feeling shaky. Um, I may be breathing fast. And then they can also lead to emotions, feeling worthless, feeling anxious. And that also leads to specific behavior outcomes, right? So I might avoid contact with my coworkers because I was just feeling so bad about myself, or I was just feeling like everyone hates me. So this is just kind of a quick illustration of the CBT model. Within this model, we consider that, the thoughts, the emotions, the physical reaction, and the behavior in any kind of anxiety-provoking situation. And the central idea is that if we change any one component of this cycle, it will lead to change in all the other components, right? So if we change the thoughts that we have in response to the situation, that can lead to very different emotions and very different behaviors. Okay. So let's break down the common components across any kind of CBT program, regardless of the specific protocol. It usually involves different stages and a variety of methods. It usually begins with an assessment for this child's specific presenting problems. And also, it will involve goal setting with the patients and the families to identify what is the challenges or what is the problems that we want to focus on and what is the desired outcome that we want to get out of this program. And it also involves psychoeducation before we kind of implement any strategies for change, explaining the CBT model and explaining how it works. It's a really important first steps. An important step for implementing CBT is also to help the children identify their negative or unhelpful thoughts that can contribute to their anxiety or depression. This might include thoughts like, I can't do anything right, or something bad is going to happen, right? So once these negative or unhelpful thoughts are identified, then the therapist can work with the child and the family to challenge and reframe these thoughts. And this involves examining the evidence for and against these thoughts and developing more balanced thoughts in the situation. Other strategies are often implemented within a CBT model, such as teaching coping skills, like problem solving skills, relaxation techniques to help the children manage their anxiety and mood. Um, it can also include behavioral strategies to help children face their fears and engage in activities they've been avoiding due to their anxiety. So oftentimes it will look like a gradual exposure to anxiety-provoking situations or scheduling enjoyable activity to help improve their mood. CBT often involves homework assignments where children will practice the skills they've learned in therapy in their everyday lives. And this really helps reinforce new ways of thinking and acting across different settings and situations. And a CBT therapy is a really collaborative process that involves the child, the therapist, and the parents to create positive change across settings. However, um, even though CBT is proven to be effective for children with a wide range of symptom presentations, adaptations are often necessary for autistic children. As we all know, ASD can look very different in different individuals, and we need greater flexibility and individualization to meet the specific needs of a particular child. So, for example, sometimes it might be harder for autistic kids to generalize the skills that they learned in one situations to a different situation, right? So they may need more practice and guidance in order to use these skills more broadly. This may means that we may have to do things at a slower pace. We may need to reorder the different components or different skills that we teach to the child um, also because children with ASD have, difficulties with social communications and understanding social cues. So some of their fears about, negative interactions with peers, they might be real, right? So we need specific adaptations that are necessary to include more explicit teaching or social skills and using like role plays or social stories to really help them navigate those social situations, in addition to helping them overcome these fears of different situations. And many autistic individuals think in maybe more concrete terms and may struggle with abstract concepts, right? So traditional CBT techniques that rely on more abstract thinking may not be as effective for these individuals. So that's why we may need to really adapt CBT to remove some of those burdens and barriers for individuals to assess, to get access to these content. So, CBT initially were designed for adults and then they were modified for application with children. So we really need to be aware of the language, the learning and developmental level of the child when implementing these interventions. Um, so unlike adults, children don't always see the need for treatment and want to come. So intervention that aims to be as fun, creative, and meaningful as possible is more likely to be effective. Um, and having a more positive focus and approach is really key for motivation and success. So in terms of the specific kind of considerations when implementing CBT, is that since kids with ASD may have greater difficulty identifying facial expressions and emotions in themselves and others, as well as discussing them, um, so specifically answering questions like, how do you feel, right? It might be really challenging for them. So a lot of ways to help with this is to put greater emphasis on affective education and practice to really help them understand or use very explicit rules or concrete informations to help them understand like feelings, facial expressions, and identifying those things in themselves and in other people. Incorporating the child's special interests into CBT can also make therapy more engaging and relevant for the individual, such as using their favorite topics or activities as part of the therapeutic process, can help with engagement. Um, in terms of the other components, right, taking sensory issues into considerations is important, because this might be a unique source of anxiety for them. Um, and like we mentioned earlier, they might need more explicit teaching, for social communication and adaptive skills, to kind of supplement the traditional CBT approach. Um, and we can be really try to be very creative with how we teach these skills, right? So instead of having them verbally communicate, say how they feel, they might be able to use other methods of communicating, right? Typing out their feelings, using music to communicate how they feel, drawing, using cartoons or YouTube clips. Um, whatever other strategies that might really be relevant for the individual. And oftentimes we really want to emphasize that we want to take a strength-based approach, right? We know that autistic individuals have these challenges in different domains, but they also have a lot of strengths in other areas, than other individuals. So we want to really capitalize on their strengths to make the treatment more effective. Okay, so now I'm going to talk about some examples of what those adaptations may look like in practice. I know we talk a lot about just big pictures, concepts, and models. Those all sound great. But in reality, like, what are those things? What do they look like in practice, at home or in a therapy room at school? One thing that we often use to help support autistic kids is to use explicit learning, like rules, to help to compensate for implicit learning difficulties, right? So there are a lot of rules that are not very clear, right, in different settings. So in terms of, okay, like when we go to this hangout with a peer or we're having a play date, um, what are some of the specific rules that are important to teach our kids so they can be more successful in that environment? Um, and we can use something like a visual structure, to help support the organization, planning, or the generalization. And we can use these like visual representations to tell them, okay, so these are the important rules to remember when we go to a hangout meeting, right? This can be applied to other situations, right? Like if you are in a classroom, what are some of the classroom rules? I think this is pretty widely used by teachers as well, that they will put these like big post-its, notes or visual tools on their walls to say, what are the class rules or expectations. And these can be really, really helpful for autistic kids walking into a situation. And increased visual supports can also help really reduce the anxiety. Um, so for example, we have this is an example of like a schedule, right? So this is maybe a little bit outdated, because back in the days when during COVID times, there are kids who might be spending certain days in the classroom, and then there are days that they will be taking lessons at home. And this is such a challenging time for a lot of individuals, especially for autistic kids, because they have to deal with these changes in their routines and their schedules. So having a visual schedule can really help them to know what to expect. And it also really helps parents too, right? So instead of having to remind their child every day or to answer lots of questions, they can just pull out this visual and to orient them to what the schedule is like for the day or for the week. Um, and when we're creating this visual support, we just want to be careful about the amount of verbal input. Um, as well, and also the amount of visual information. So we want to keep it simple and straightforward, and the more likely that it's going to be clear and easy to follow. And we want these visual information to be readily available in the environment so they're more likely to actually use them. Um, like I mentioned earlier, a big part of components of CBT is to challenge our thoughts, right? So the things, the worries, the thoughts that can often come along with different situations. Um, so we sometimes use these metaphors or analogies to explain some abstract concepts. So one example here is, for example, fortune telling. This is a very common thoughts or patterns that we fall into that can lead to anxiety and depression. Fortune telling is basically you're making prediction about the future without any concrete evidence, right? So if we're using this term fortune telling, it might be a little bit easier for individuals to understand what that means. And we can obviously this language needs to be tailored to the individual's developmental levels, or it needs to be relevant to what their cognition is to target those challenges. And instead of using just big picture or explaining abstract thinking, oftentimes it's helpful to use specific examples that are relevant to the child to explain these concepts. Another tools that are really useful for adapting our intervention is social stories. So social stories are basically very short stories with pictures that can be used to, teach a lot of different skills. There are visual strategies that can use to like teach social skills, address problematic behaviors. There are these like short, brief narrative that can describe a social situation and then explain or like problematic behaviors. They can explain what is the problem, why it is a problem, and offer an alternative solution to the problem using like pictures and very little amount of words. Um, and comment streak conversations are another way to help with conveying these information more visually. They can depict social situations and also have these like thoughts and word bubbles that are used to help teach the individuals about the problematic behaviors and maybe how other people might respond to their social behaviors. For younger kids, actually, social story can be helpful for teach specific skills, right? So it can be like daily living skills, having a social story about the morning routine, like, what are the different things that you need to do in the morning when you get up from the bed, you need to brush your teeth, pick out your clothes, step by step, and use that as a way to teach those morning routines. Um, and it can also be used to prepare our child before they need to, transition to a new setting, or there's an event that is upcoming, right? So use pictures so that they can actually visualize and knowing what to expect and help with that predictability and being prepared before they need to, attend a new school or go to a doctor's appointment. These tools can be really used across a lot of different settings. Another important adaptations or things that to include in treatments for anxiety and depression is to teach coping strategies. So these are things like teaching our child how to calm themselves and reduce stress. And what, especially, when we see our kids that may engage in maladaptive coping behaviors, that may look like uh, tantrums or aggressions. We're kind of teaching them these skills to replace those more maladaptive coping behaviors with the more adaptive ones. Um, so, for example, we first need to assess like what is a helpful or calming strategies for our specific individual, because they can look very different. Like for some kids, maybe listening to music is very calming. Maybe for some kids, they really needs the sensory stimulations, right? Like having like a tight hug or having a fidget toys that they can play with can really help to reduce their anxiety. It can look very different in a different individual. So we just want to be very mindful that these coping strategies or activities can look very different. um, it's oftentimes very helpful to have a calming space. These places, it's like a specific place at home or at school that can be used for doing these calming routines or strategies. And we also need to develop the steps in the routine, right? Instead of saying that when you are stressed, you can calm down or you can do these relaxing activity, we need a specific routine, right? That specifics every single steps that is involved in this routine, so that our kids are more likely to engage in them and be able to do them more independently. So these things can like you may need a visual cue to cue them, okay, like it's if you now it's time to take a break, or it's time for calm down, or it's time to go to the calming zone, right? Whatever term that you used to cue them. And then you also need a clear finished and what's next, right? So when is this calming um, space, or when is this calming routine is over? Um, and I think a big uh, mistake that we often fall into is we think that we want to teach or practice these calming strategies when our child is anxious or when they're in this situation. Actually, we want to teach and practice these routines when they're calm. The reason for that is we all know when we're anxious, when our emotions are high, it is really hard for us to learn anything new or to teach or to remember to practice things, right? So it is really it's less likely for them to be able to use these strategies. So that's why we need to practice these skills or routines when they're calm, when they're not anxious, so that they're more likely to internalize, to learn these skills, and then use it when they're stressed. And I think a big part that a thing that we've heard a lot from parents is that yes, they teach these skills, they practice with their kids when they're calm, but when they're anxious, they don't engage in these routines, right? They don't know, like they are not spontaneously practicing and starting to take deep breath, for example, right, or going to the calming space, we know that initiating these routines, they might need more specific prompting, or they might need specific reminders so that they're likely to engage with them. Um, or we need to be creative in terms of how they can request this routine, right? So maybe we'll have a specific visual sign or cues they can use. They can pick up the sign like a stop sign, or something that they created ahead of time to say, when I use this sign, that means I need to go to the calming space, right? So something that is not super demanding, that's easy for them to use. They have practiced ahead of time, so over time, they will be able to kind of do that more spontaneously and do it more independently. But I think it does take practice and the parent support to get there. Okay. So what does those calming routines look like? So there are some of the ones that maybe a lot of you guys have heard about or have practiced with your children. For example, like deep breathing, um, progressive muscle relaxation, basically tensing and relaxing your muscle. These are some strategies that can really help to calm our body. um, and other strategies like imaginary or like imagery, visualizations, kind of imagine you're in a calming space or engaging in calming activities. Visualizing those activities can be helpful for certain individuals. Mindfulness is something that can be taught to kids as well. Um, Maybe there's like a mindfulness video or audio that the kids have practiced before and they liked, that can be used during the calming routine as well. And there are a lot of online resources for those like mindfulness activities. There might be more age appropriate for different developmental levels. um, Having these mantras or helpful thoughts it can be helpful in these situations. So these are some of these like internal thoughts or helpful thoughts that we maybe develop with the kids ahead of time. And then every time they're stressed, we can remind them to kind of think about these helpful thoughts or even verbalize them in the moment. Having some fidgets or stress ball can be helpful for certain individuals. And remember, like I think incorporating their special interest can be very helpful, right? So for individuals who are really into like certain toys or activities and characters, incorporating those things into the calming routine can be helpful as well. Okay, so here is just another example of visuals to support our autistic kids to understand their own emotions. So this is what we call like a stressometer, about like using this as a way to teach and communicate our emotions. Um, so and so from this is like the green, yellow, and red zone, right? So we think about green means that we're calm, right? We're chill, we're relaxed. And then when we get into the yellow zone is we're getting a little bit anxious. It's a little bit harder for us to pay attention. I'm a little nervous, right? And then the red zone is that you're feeling like I'm going crazy, I can't breathe, and I'm about to have a panic attack, right? So this is kind of using these visuals can be really helpful for our kids to think about where they're at, and then also to use it to communicate with us. Because in the moment of anxiety, less language and less demand is usually better. So we can ask them, in our kids, instead of how do you feel, if we have already teach them or taught them this scale, we can ask them, what zone are you in? And all they have to say is, I'm in green, yellow, or red, right? And that can really help us establish a language um, to teach emotions. And it's whatever system we're using. We can use this scale, we can use a completely different scale that makes more sense for individual. Instead of 1 to 8, it may make more sense to do like a 1 to 5, or just do yellow, green, red, or use other ways to visualize it for our kids. Whatever system we're using, it should be used across different environments, right? So it's important that we have the same language across the teacher, the parents, the grandparents, and so that everyone knows the plan. Um, and we also, again, like we mentioned before, our kids may not come to us and tell us that when they're anxious, they may not know how to ask for help or ask for taking a break. So for parents, it might be important initially to kind of identify or like be in tune with our kids when we notice that they're starting to get a little bit more anxious, to check in with them and to prompt them or to help them initiate the calming routine, especially at the beginning. Um, this is just another kind of slides to emphasize the points that oftentimes it can be challenging for young kids to have this self-awareness of their own symptoms, right? So they not in the moment when they're anxious, they're not recognizing that they're having these physical symptoms or emotional symptoms. So focusing on kind of affective education, like teaching them to recognizing these signs, using a shared vocabulary and language, help them rate their anxiety level, and then also develop a plan to reduce stress. All those things are important steps to create a effective calming routine. Um, this is just an example of a coping plan. Basically, it kind of include all the different components that we talked earlier, right? Having a specific routine that is developed specifically for our child, and take it step by step, and also have visuals that help them to be able to follow instead of having to look at the words, especially for kids that are maybe younger or nonverbal. Having pictures itself, it's already maybe enough instead of having any words on the plan. So in this plan, for example, this is created specifically for one individual. It's probably not going to work for other people. Is that when I'm in the yellow or red zone, right? This is when I'm going to use this plan. And step one is we take 3 deep bubble breaths, right? This is something that we practice and we have taught the kid before. Step number two, think of my favorite TV show for a minute. Step number three, listen to a song. Maybe a specific song that they really like. Number four, tell myself everyone makes mistake. I can just try again, right? After those 4 steps, then check in with my emotion. Am I in a green zone? Right. So they have to evaluate themselves and think about where they're at. If they're not in the green zone, then restart coping plan. Remember, I've got this, right? So this is a plan, an example plan that can be used for an individual, after we have developed um, this plan collaboratively, with the parents and with the child. This slide is talking a little bit about kind of the thought components of the CBT model. Um, like we talked a little bit about it earlier, is that a lot of the times that anxiety is associated with automatic thoughts or sometimes negative thoughts about ourselves, about the world, or about other people. Um, so these thoughts are actually really common. We all have them. And we need to first identify these worry thoughts that are relevant to the patient. So these things can look like sometimes something bad is going to happen. Um, I can't do this. I need my mom to make me feel better. I will be embarrassed. What if I do something stupid, right? So these are the common automatic thoughts that can lead to, anxiety or worries. And then we also we want to think about how do we restructure these thoughts by challenging them, right? So we have to help our child recognize their worry thoughts, what they are, and then dispute them with more realistic evidence, kind of becoming a thought detective. And then we need to help them develop coping thoughts and self-talk that are more adaptive, they're more helpful, right? So these self coping thoughts can be like, I can do this, I've never failed a test before, most dogs are friendly, people fly on planes every day. What is the worst that can happen? Am I 100% sure that whatever they're predicting will happen? Just to give some examples. Again, visual supports are really helpful too in identifying thoughts and feelings. Um, so having thought bubbles where children can write down their negative thoughts and coping thoughts can be a way to engage our child rather than just relying on verbal information. And outlining the body and identifying particular areas where emotions are experienced when they are, experiencing, anxiety can be a helpful way to kind of help them identify the physical reactions. Um, we can use cartoons that where children can write out symptoms of and situations in which the anxiety and sadness occurs most often, and then generate coping thoughts, and also like other drawing exercise or using videos to create their own videos about how they face their fears and cope in different situations. Again, social stories will be helpful as well. A big part of treatment for anxiety is exposure. Kind of in simple terms, exposure just means that we need to expose our child to the situations that are anxiety provoking for them in the so that they can kind of experience the success of being able to tolerate their feelings in facing these situations, so they're less like, so that one of the presentation of anxiety is avoidance, right? So instead of avoiding, we actually want them to experience those situations. um, However, we need to do it with really a lot of uh, kind of clarity in terms of doing in a way that would not be would be able to help our kids to do more and in the future, right? So first, we need to determine what are those anxiety provoking situations. And then we need to create a letter, or we create a hierarchy of these situations that are from mildly to moderately stressful. And then to the top of the hierarchy will be the severely stressful situations, right? It really needs to take a gradual approach for our kids to experience those situations in a more controlled environment. So instead of throwing our kids in there into the situations and then, have them experience the negative outcomes. Um, and then within those exposure and practice, we need to incorporate the coping skills that we have talked about earlier, using visuals, encouraging statements, and setting up a reward system so that they're more likely to, engage in these activities. Okay, so this is just an example of what a graded exposure or gradual exposure may look like. This example is for ordering food in a restaurant, right? So there are kids who are really anxious, and then they are too anxious to order food in a restaurant, and they always ask their parents to do it. Um, what the steps of success or graded exposure will look like is now, first, we're going to start with the least anxiety provoking situation, like a mildly anxiety provoking situation, like ordering a Coke at a McDonald's drive-through. So there is not a person that's in front of you during that interaction, right? So it might be less stressful. Second step is that you go to a sit-down restaurant, order a Coke, and then the parents can order food for them, right? So the demand is that this is a little bit harder because it's a sit-down restaurant. There's a waiter who is coming in person, but they don't, instead of ordering a whole meal, they only need to order a drink for themselves. And then next step is that order a Coke and then say, I'll have this, right? Pointing to the menu at the food items that they want to order, which is a little bit more challenging. And then finally, the step is that they're able to order a Coke and then what other food items in a restaurant, um, just to illustrate that, the level of gradual kind of exposure is that we are really doing these very carefully designed exposures in a very gradual manners that is, challenging our child to be able to face their fears and then being able to successfully complete these exposures. Also, like, equipping them with the other strategies that can help them manage their anxiety in the moment. This is just another example of what the graded exposure may look like for making mistakes. Um, these are things like, first you can make a mistake while writing your name, erase it only once, and then turn in the paper. And then the next step will be make a mistake writing the date on homework. Do not erase it, and then turn it in. And then the next level will be make a mistake on a math homework, and then lastly, making a mistake on a spelling test. You can see here that the difficulty level increases as we get up the steps of this exposure. But again, we're doing it in a very careful and controlled manner, and then also helping our child to manage their behaviors or manage their anxiety by teaching them the strategies to like calm down, breathing skills, and then also the specific things or thoughts that they can tell themselves while they're doing these exposures. Okay. We do recognize that when our kids are struggling with anxiety and depression, it can also be really stressful for the parents on a day-to-day basis, right? It can also lead to parents' anxiety when they are seeing their kids suffer with these difficulties. So this is just a one strategies that we sometimes teach parents to how to handle or react to their child's anxiety in the moment, right? It's called calm. C is for catch your breath. When your child is having a breakdown or having an anxiety about certain situations, first catch your breath, pause to think um, briefly so that you can become calm and plan a response before you react. Um, A is for accept negative feelings. It's okay, like it's normal um for parents to have negative feelings when these things happened in their child, right? They might be feeling angry, they might be feeling really worried, or they might be feeling really upset. These are all really common feelings in the moment. So just to accept the negative feelings in a moment and say, okay, I see I'm feeling this way. And I want to, also label the emotions you for their child, right? So if your child is getting angry or worried, you can say, you seem really angry or you seem really nervous. You can like point it out to them. And then we can have parents model the coping skills, like show your child through your own behaviors how to remain calm and collected. Really modeling the coping skills in the parents so that because our child really learn from modeling and learn from observing their parents as well. Okay. Some other tips for parents to that they can help their kids in the supporting their child in a moment, validating feelings in a moment. Um, so what does that mean is, validating and just saying that I see you're worried. I see you're getting upset. Validating is just comforting, really helps parents model those affective expressions and labeling those emotions and putting words to their child's physical and emotional response. Um, and we also can think about other things that teach parents can do, right? Changing the environment. They can maybe increase the predictability of the environment using visual schedules, social stories, countdowns, giving them a heads up before transition to kind of prevent or help to alleviate these anxiety. They can offer them choices ahead of time to give the child a sense of control. Um, and in terms of situations that are anxiety provoking, but we can't really avoid it, right? There are a lot of situations that we can't really avoid, is that, we may be able to help them by pairing those anxiety provoking situation with more positive activities or a reward at the end so that, makes the situation a little bit less anxiety provoking. Again, teaching and practicing coping skills with your child would be really helpful. And then also encourage your child to use these skills when they're anxious, right? It's okay to feel anxious, but instead of being angry or throwing a tantrum or avoiding, right, you can teach them to voice their fear or anxiety and say, I need to take a break using a break card or asking if they're getting anxious about not knowing what's going to happen, you can teach them to ask what is happening next. And using prompts to use relaxation strategies like deep breathing, muscle relaxations, and other like calming objects or activities. Um, so these are some other things the parent can do, providing positive reinforcement for brave behaviors. Um, and in terms of like, just be mindful of like how we respond to anxiety. We can definitely validate their feelings, right? We can say that, I see you're getting anxious. It's okay to label those feelings, but we also want to convey confidence in our child's ability to handle distressing situation, right? We can say that, I know this is really hard, but I really believe in you. I think you can get through it. I think you can tolerate it, right? So instilling those confidence in our child can be helpful too. And you can model your own courageous behaviors and coping skills in the moment of stress. And we also want to emphasize that it's important to work together with your partner or other caregiver to create a plan and be on the same page because our kids really benefit from consistency across settings and across people. So, really having the same plan across individuals will be helpful for them to learn. So I know that this comes up sometimes as well, is that when we're in a moment of crisis, right? When the behavior or the emotion is so high that the kid is getting really dysregulated or getting unsafe, these are some of the tips or things that we want to keep in mind. Um, Especially when our child is getting really, really anxious, that actually saying less is better because it can be really overwhelming for them in the moment when there's a lot of talking involved. Reducing language, staying calm, reducing the demands, reducing the sensory load, and just try to provide very clear visual cues of what they can do, or just quietly direct them to a quiet area or like a calming zone, so that they can keep themselves safe and maybe use those learned coping strategies. Because when in a moment of crisis, it's not really a best moment for teaching. So this is really the last slides that I have. It's just some examples of specific CBT treatments, protocols that have been developed for youth with ASD and anxiety. These are just some things that you might see when you work with a therapist or psychologist. But I'm not going to go into details about this, since this is not really a clinical training, but I just wanted to give some examples. Lastly, I know that we've only focused on behavioral or cognitive behavioral therapy, and behavioral strategies. Um, in certain situations, or in a lot of these conditions like anxiety and depression, medication is also a treatment. And oftentimes, it's most helpful when they're paired with therapy. It can really help children to assess therapy better, especially when their symptoms are more severe. And the providers who can actually manage the medication would be a child psychiatrist, that they can do like a more comprehensive evaluation and answer questions about whether medications are appropriate for the individuals. And these are, often a collaborative process, and it require monitoring to make sure that this is what is the right type of medication and dosage. But again, I'm not a psychiatrist. I'm just wanting to, keep that in people's mind that medication could be helpful for children with ASD and co-occurring anxiety and depression as well. All right. So that is the end of my presentation. So I think, like Doris mentioned, that there will be an online evaluations that will be emailed to you in the next few days, along with a handout that will kind of summarize the important points that we make in this presentation. And here is the email address for the Regional Center of Autism Spectrum Disorder at our system. So if you have any questions, you can also email us here, we can provide some guidance and support. Yeah, so I'm happy to take a few questions. Unfortunately, I do have a hard stop at 12 o'clock, but I think we still have a few more questions. Thank you.
Yes, thank you, Dr. Chen. We really appreciate it. As mentioned earlier, we will now open the floor for Q&A. Please make sure to write all your questions in the Q&A chat. We also are taking questions from the Facebook. So our first question from the Q&A is there any particular age not to increase PD predictability, as this can also become anxiety provoking, and the reality that we can't always predict what will happen?
Yeah, this is a very good question, because I know that when we talked about predictability is not always realistic to know exactly what's going to happen in different situations, right? So I think when we talked about predictability is, if there are situations that there are more structures that we have better control over, really helpful to keep that in mind, to help our individuals to access, like, let's say, the content they need to learn at school or access therapy. At some point, if if that's not possible, right? In other situations, we may need to think about how do we increase flexibilities and adaptability of our individuals. Let's say they have to, adapt to a change in a routine that are upcoming, right? Or they need to switch schools, that we need to prepare them ahead of time. But maybe thinking about like there are certain things that like schedule may change, and that's something that we really can't control sometimes, that we might want to think about developed a more creative way to do those structure like exposures for our child to kind of get those exposures in a more gradual manner, right? Like one example I gave earlier is to like the exposures about like making mistakes. Maybe we can think about like an exposure that we can do with our kids if it's meaningful for them and it's something that is interfering, right? That how do we develop graduate exposures that they can tolerate changes in certain routines or orders of things that they have to do things so that they're better at kind of dealing with those difficulties.
Okay, we have another question. Do you have a list of therapists that are accepting patients right now?
Um, yeah, thank you for that question. I think that is a broader question. So I am, we are at the NYU Child Study Center. We do have an autism service. So basically all the clinicians and psychologists and psychiatrists are specially trained to work with individuals on the autism spectrum with other co-occurring disorders. So, this we do have, I believe we do have a wait list here, but you can always reach out to our intake team at this child study center to inquire about like, how long the wait list is. We also have a lot of trainees here, like, myself postdocs, and then also doctoral level travel doctoral trainees in their doctoral training, like we call them externs, that are also accepting seeing patients here. So those are some options. And I think there are also other providers in the communities that you might be able to access through other organizations as well. Yeah, but that's a bigger, broader question. I don't know if like maybe depends on like what areas and what age range and that you're looking at.
Thank you, Dr. Chen. We have another question. As my child grows up, are there any signs I should look out for to consider if medication is required for her anxiety or OCD?
Yeah, so that's a really good question. I think always monitoring symptoms are, definitely very helpful. And when we think about when these becomes a bigger problem is whether it is getting in the way of them being able to do their daily activity, them being able to go to school, or if do they result in significant impairments in areas of their life, right? If they are getting really depressed and then they're not willing to go out of the house and do things, or they're no longer, seeing their friends or going to school, right? Those are, more like big red flags, like we need to do something about it, right? So I think in that, obviously we don't want to wait until that point to take actions. When we're starting to see that there are, starting to these changes, like we mentioned earlier, symptoms and signs that you have noticed, that it might be, good to seek out professional help even earlier, just to kind of assess the level of interference or level of severity of these symptoms and what is the most, helpful approach at the moment. So I would say identifying early and acting early is always better than waiting until the problems gets worse.
Thank you. So Dr. Chen, we have one more minute. So we won't take any more questions because I know that you said you'll be stopping at 12. So if anybody has any questions, please feel free to email our intake line. All that information is on the chat. I also included a survey in the chat. If you please can stay just a few minutes to complete that, I would really appreciate it. So thank you all for joining us today. Thank you for those joining us via Facebook Live. And I hope you guys have a great rest of your day. Thank you so much, Dr. Chen.
And thank you so much.
Of
Have a
course.
good one. Bye.
Bye. So I'm just going to stay on a little bit for those that would like to complete the survey. Thank you so much for joining us today. Really appreciate it. Alrighty, thank you everyone, and that concludes our presentation for today. Have a great rest of your day.